Good afternoon, and I want to say that it's good to see everyone, and thank you for joining us today at St. Mary's Food Bank. With me today are Tom Curtis, the President and CEO of St. Mary's Food Bank, Dr. Kara Christ, who's the Director of the Arizona Department of Health Services, and Major General Mick McGuire from the Arizona National Guard. St. Mary's Food Bank is the world's first food bank. Started here in 1967 by John Van Hengel, a man given $3,000 and an empty warehouse to make his dream of providing food to those in need a reality. And boy, have they brought this to life here. Here, with community support, countless Arizonans in need are provided with food. And it's here that the generosity of our citizens to help their fellow neighbor during times of challenges on full display all year long. This year, as the world faces unprecedented challenges during the COVID-19 pandemic, St. Mary's has really risen to the occasion, Tom. We're so grateful for your work and for the work of everyone here, from full-time staff to all the volunteers that you have. We've got an announcement today about how we are partnering with our food banks as we head into the holidays. But I want to start with an update on our biggest challenge we faced this year, COVID-19. Across the country, cases of COVID-19 are increasing, and Arizona is no different. We've been through this before, and we've learned what works to combat this virus. We've had time to prepare. The Department of Health Services is partnering with county public health officials to address local hotspots with the largest spikes. And they are also working closely with schools to prevent and respond to outbreaks in those settings. With enhanced guidelines in place for schools and businesses, and with the leadership of our educators and our business community, I'm confident that we can continue to protect public health and keep our economy moving during this time. I want to turn it over to Dr. Christ for the latest. Doctor?
Thank you, Governor Ducey. So I wanted to provide an update on the trends our public health experts are seeing in Arizona and the steps we're taking to protect Arizonans. We are seeing the spread of COVID-19 moving in the wrong direction, and public health officials across the state are working in collaboration to control this pandemic. To date, a total of 242,480 cases have been reported to public health. The recent increase in cases has resulted in an increase in the COVID-19 rates in many counties, and last week the percent positivity increased to 6.3%. I want you to know that at the Arizona Department of Health Services, we remain on high alert. We've worked to contain COVID-19 from all angles, and we continue to take further action in light of recent increases. Our actions to date include increasing access to testing, increasing hospital capacity, and ensuring businesses and schools are partnering in mitigating the spread. Over the last few months, we've worked to build up our lab capacity, ensuring every Arizonan has access to COVID-19 testing with quick turnaround times. There were approximately 76,000 to 87,000 diagnostic COVID-19 tests conducted each week over the last 2 weeks. And our major laboratories are currently reporting less than a 24 to 48-hour turnaround time. And there are approximately 500 locations where Arizonans can get tested. And we've enhanced contact tracing at the state and local levels to ensure that once a case is identified, every effort is made to contain it from spreading further. Over the past few weeks, Arizona has seen a gradual increase in the 7-day average of cases and hospital usage. We are working closely with our hospital providers to monitor capacity, and we have invested significantly to ensure all Arizonans have access to care. To date, we've invested almost $150 million for our hospitals and healthcare partners, including $91 million for the purchase of PPE, $34 million to augment Arizona's hospital staffing resources, $10 million to increase hospital bed capacity by supporting alternative post-acute care for COVID-19 patients, and $10 million to the Arizona Coalition for the Healthcare Emergency Response to purchase and distribute 660 ventilators to hospitals. As businesses reopened, we developed requirements to implement mitigation measures, such as reduced capacity and requiring masks. And these requirements are being enforced. As of yesterday, we have received almost 1,900 unique complaints about establishments out of a total of 3,500 complaints. Of those unique complaints, 89% have been addressed and closed, and almost 400 on-site investigations and 1,300 technical assistance and education calls have been completed. We have 7 counties who have agreed to investigate complaints, and we have approximately 32 investigators at EDHS who continue to ensure compliance with the COVID-19 mitigation requirements. We've worked closely with the education community to ensure the safe reopening of our schools, holding weekly meetings with local health officials and the Department of Education. During these conversations, our partners expressed concerns about the instability that would occur if recommendations to move back to virtual learning were based on a change in a single benchmark, especially in smaller rural counties. This variability could cause weekly shifts in educational delivery model recommendations, which would result in uncertainty for families and schools as they plan for the upcoming weeks. To address this, we recommend that all schools meet all benchmarks before moving from in-person, hybrid, or virtual learning. But to be clear, and we're going to clarify the existing guidance later today, we continue to recommend to our schools that they work with their local health departments who have more specific local data to inform their decisions. And so we understand that this has been a difficult year, and many have grown tired of the mitigation strategies. But now is not